Good morning. This is Steve Stites, Chief Medical Officer of the University of Kansas Health System. We're here in the Dolph Simons Family Studio broadcasting to you live. And I'm joined today by two guests plus a special guest. I'm going to start, I guess he's not really a guest. Hawkeye, you're not a guest anymore. You're just here all the time. What are the numbers like this morning?
Numbers really are fairly stable. You know, last week we had a lot of mid-30s to low 30s. Today we are at 26 inpatients. We have 8 in the ICU. We have had some discharges as well, so that's a good thing. So, you know, again, with a little bit of cautious optimism, maybe these numbers will stay low, but we need to continue to do the right thing.
So surge, wave, not a surge, flat. Have we bent the curve? What euphemism are we today?
I am going to say at this point we are probably have bent the curve a little bit into the way that we wanted it to go. Not higher, but lower, maybe to a flattening.
It's still pretty early.
It's still very early.
And when we reopen society,
yes,
which we know we need to do, and that's coming, it's going to be really important that we do the key things we talk about every darn day. Wash your hands, keep your distance, don't touch your face, cough into your elbow, and if you're sick, please don't go to work. In fact, we have a patient who's going to be with us today in just a moment. Anthony will be on the line, but first, Dr. Raghu Dendi, one of our excellent cardiologists here at the University of Kansas Health Center, our University of Kansas Health System, is with us to talk a little bit about what's going on in the cardiac world related to COVID-19. My question to you is, where have all the heart attacks gone?
Thanks for having me, Steve. That's a big question that's across the country. People are asking why the total heart attacks numbers have gone down. I don't think the numbers are uniform across the country. The reported incidence of acute heart attacks are down by 30 to 40% in some areas of the country. When we looked at our own numbers, Steve, it was not as much of a reduction. There is a slight reduction. But what we noticed that's concerning is that the number of people with minor heart attacks are not showing up. And that's something that we are worried about. And I wanted to quote one of my chief of cardiology, Wiley's comments yesterday that, you know, heart attacks don't stop during pandemics. And they keep happening, but people may be underreporting them and sitting at home and not taking care. The other cause could be that people are not doing as much physical exertion anymore, not going to work, not lifting a heavy objects, and maybe they're not triggering their disease as much.
So I kept clinging to this idea that maybe the real thing is people were bored and they were taking their medication. I mean, the average patient is about between 50 and 70% compliant with drugs. Now you have nothing else to do, so maybe they're deciding I should take all my meds to make sure I stay healthy. Do you think that might be playing a role in it? I'm just speculating at best.
It's possible. We don't have medication shortage, and we people are paying attention more to the health. You know, COVID crisis has brought more awareness to your whole body health and taking care of yourselves. I'm sure that may have some role to it.
Do you think it could have to do with washing your hands? Because maybe washing your hands is exertion, it's exercise. Somehow that's making us have fewer heart attacks.
I don't know what that.
Okay, fine. Cardiologist shoots me down.
Hand washing can protect against heart attacks. Let's get that out.
I think that's a new study. Let's do that. Okay. Any questions so far for Dr. Dendi or Dr. Hawkeye here, Dr. Hawkinson, before we bring our patient on?
Yes, doctor. I've got a question. This is Bob Winter. What about the situation with the UV light situation on stopping of the coronavirus?
You bet.
There's a lot of rumors out there about this, and I understand through different sources that this is the way you sterilize a mask. Is this one way to stop it? Am I correct on that point?
Well, it can certainly work toward re-sterilizing things, and even UV light, and I'll turn to Hawkeye here in just a minute, UV light can be used to sterilize a room, but I don't know that we can't sterilize all society with it. That's a struggle, Dana, and it can degrade masks a little too.
Yeah, I mean, overall, we know that ultraviolet light, that radiation that comes from the sun, you know, certainly more than the heat, can destroy and do damage to things, viruses, bacteria, our skin. Obviously, we know that UV light can cause skin cancer. So yeah, ultimately, we know that UV light or UV radiation can destroy the virus. And some places are using it to help sterilize masks and room surfaces. It's just a matter of we need to make sure that those photons or those radiation rays do get to the surfaces to do that.
Actually, we started using hydrogen peroxide here because we know that there's this, and you can describe this better than I can. Actually, it's probably more effective with less damage to the mask itself.
Yeah. Overall, we know that it can reach the surfaces, all of the surfaces of the mask itself, a lot easier. So we've kind of gone to that. But some institutions are using UV light as well to help.
Other questions?
Yes. What about the issue with sunlight when it warms up? Will that help stop this coronavirus happening? Because we're right now in the midst of the summer months. Will that help alter this thing so everybody can get back to work?
Well, we wish it were true, but remember there's a lot of coronavirus in the southern hemisphere and in desert climates as well. There's a lot of coronavirus in Phoenix and other places. What we do know is that coronavirus historically, because there are many different types of coronavirus, can be very seasonal. We also know that one of the SARS-CoV-1, which causes SARS, tended to come out, was really awful, and then it sort of disappeared, and we can only hope that SARS-CoV-2 will follow that trend. But because SARS-CoV-2 is so easily transmittable, it acts more like the other coronaviruses and less like SARS-CoV-1. And because of that, we're concerned that it won't just disappear as SARS-CoV-1 did, or what's called SARS. What we're hoping, though, Dana, is that there will be more seasonality to SARS-CoV-2. And if it goes away for a while, we're still afraid it could come back. But that gives us more time to work on a vaccine and therapy. But whether or not it's going to go away from just because of warm weather is probably not the case.
Yeah, we have to remember too, I don't know what kind of warm weather we're talking about. People have different ideas of what warm weather is. Is it 75? Is it 80? Is it 90? Remember, our body temperature is 98, around 98 degrees. So that virus can live and multiply on that temperature. As you get a fever, that goes up to 100, 104, 105. The virus is still multiplying at that point. Just having the sun out in the summer with that temperature, that in itself is probably not really going to be a factor. I would think more if you're talking about environmental and outdoors, you're maybe talking more about the UV radiation to actually have any effect on that. But there's also other environmental factors such as humidity levels and things of that nature, and just the virus breaking down easier, probably outside in the environment rather than in a store or on shelving or something like that.
Yeah, and I would say that it's pretty prevalent in Texas and New Mexico and Arizona and Southern California too. So, other questions?
This is Taylor, Channel 41. I've got another question about the masks. How much am I lowering the efficacy rate of my mask if I don't wash it between usages? If I wear it out to the store, do everything I'm supposed to do, not touch it, that kind of thing, come back and just leave it in my car, don't wash it between the next time I use it, how much am I lowering how well it's going to work the next time I go out?
Dana?
Yeah, that's a difficult question. I don't know if there's any published reports or scientific papers on that. Certainly, you want to continue to try and be hygienic and clean, and I think washing it in between uses overall is just going to help that continue to be clean. As far as reducing the efficacy, again, remember the mask that we're talking about is not biomedical grade. We are using that to protect us from other people just in case we are infected. And so that's really the goal, is to really stop any droplets that are large enough to be stopped by that probably cotton mask or whatever. And so I think, again, just being hygienic and cleaning it, if you have a couple, you can have one being cleaned, one that you have in storage, and one that you're using, and just keep rotating them.
And when you say clean, just throw it in the wash?
Yeah, I think washing machine, especially if they're just cotton masks.
Yep. And Dr. Dundee, one of the things that has come out with COVID-19 is a great deal of cardiac issues. Talk to us a little bit about that, because we know that once you start having irregular heartbeats, that's a really bad sign.
Yes. So patients who are suffering from COVID-19, they're critically ill patients, the number one cause of death is pulmonary complications. But second to the pulmonary complications is the cardiac complications that seem to be the second leading cause of death in COVID-19 critically ill patients. And there are many different ways the heart is being affected by this virus. One is the inflammation itself. We call it myocarditis. The inflammation of the muscle makes it weaker. Second, the hypoxia, or the lack of oxygen in the lungs, it further affects the muscle in the supply and demand mismatch. And patients, when they go into multi-organ failure, the heart is not able to meet the demand and is not able to supply. And then arrhythmias seem to be also part of the COVID-19 picture. Some of it is due to the infection itself, but some of it is from the electrolyte imbalance which the COVID-19 patients seem to have, and some of it is from the medications that we're having to use. Some of the antibiotics have potential to cause arrhythmias. We watch for those very carefully. And but not the least, this infection seems to also cause thrombosis or clot formation in the arteries, and can cause clinical pictures similar to heart attacks and clots in the lungs and pulmonary embolism, one of those fatal clots in the arteries that are coming into the heart.
Yeah, it can be really a tough ending. We have today a patient who was treated here through the University of Kansas Health System, somebody who we know well, actually, one of the folks who works with us, Anthony Nickens. Anthony, you on the line?
Hey, yep, I'm here.
All right. So, Anthony, fortunately, you've gotten a lot better, and we're really glad, and you have not had the cardiac problems and other things, but talk to us a little bit about what it was like to have COVID-19 and how it's affected you and your family and the recovery.
Absolutely. So on March 30th, I started to experience real symptoms. I had come to the health system, and they checked my temperature at the door. It was 97, and I was fine. By the end of that day, I had started to experience a pretty dry cough, and it wasn't normal dry cough for me. I have seasonal allergies, or year-round allergies, and it wasn't like a normal cough for me. It was a lot of agitation in my lungs and in my chest, and so I noticed that was different. So I got home and I just laid down. I laid down because I was exhausted. So there's the fatigue, and I started to realize that I might have a fever here. So I kind of stayed away from my family. I moved back in with my family about a year ago. So there's about 4 of us in the house, and I have my brother and my sister-in-law in St. Louis. And I was telling my mom about how I was feeling. Of course, my senses were heightened with everything that's going on with COVID-19. I texted my boss, Jill, and I said, hey, I'm having a fever right now. I'm not going to come into work tomorrow because I know, the status of what's going on where we are with this disease, and I'm not sure if it's that. It might be my allergies, but I will stay home and just kind of keep you updated. So one of the things I did was I kept the temperature log. Like every hour I would take my temperature and, map it out, see what was going on. I kind of wrote down what medications I took, so like Tylenol, Mucinex at certain times, and what my temperature would do due to taking that medicine. But yeah, I just kind of tried to stay on top of it as much as possible. And fortunately, people who were working with me didn't contract the disease. But unfortunately, my family did experience COVID-19. 2 of my family members who live with me. But gratefully and thank God, we all made it through, and we all got better.
And you were tested. You had a swab that was positive, I think.
Yeah.
And how was the swab? Did it hurt when they did it?
So the thing is, I had taken a flu test a few weeks prior, because I did have the flu a few weeks before I had COVID, and so that kind of prepped me for the swab. Yes. Because that was something. But that COVID swab is a different beast. It's a different beast altogether.
Yeah.
But yeah, it wasn't too bad. It wasn't too unbearable. But they got up in there.
That's the plan. That's what we say. No pain, no gain, Anthony. That's how it works right now.
For sure.
And so that was positive. But the best news is you've recovered and you're back at work.
Absolutely, yeah.
In fact, I think you're around here someplace.
Yeah, I'm somewhere.
All right.
Can't see me right now.
I wonder if there are questions from our media friends or anyone about to Anthony or to one of us. Anything you wanted to ask?
Hi, this is Celia from the Kansas News Service. I wonder, so, now Anthony has antibodies to COVID-19, and we don't yet know if those are long-term, those have a long-term effect. What type of scientific, clinical trials are going to give us an answer to that, and how long will it take to know if someone like Anthony is now protected long-term?
That's a great question, and it's one, we're struggling with because we don't have the answers, although I think the tests are getting better. Last few weeks we've been saying the tests weren't great, but I think they're starting to get better, Dana.
Yeah, absolutely. So this speaks to the amazingly dark immunology of this virus. Just as we know that the virus has tropism for different organs, meaning it can go to different organs about the heart.
You can say what tropism is.
Yeah, tropism meaning it's just it can go, basically it can go to different areas of different organs and affect different organs.
Your body.
Yep. The heart, the lungs, obviously the brain.
Kidneys.
So we can see this. Anthony serves as a good model of what we've been saying. Most people are going to be able to be managed at home, and they're going to recover. But it does take a toll on you. Anthony is a young man. He's healthy, but he has been worn down for the last couple weeks as well. So what does that mean now moving forward? Will he get ill again? How good is his immunity? We just don't know that. Probably studies are going to, they're ongoing. People are enrolling in those now that we've seen it. But we probably won't have a lot of good information for that, probably for 3, 6, 9 months, even a year, because we then have to look at, well, number one, do you have antibodies? And we know that the antibody testing, although Dr. Stites said it is getting better and we are getting more accurate testing, we still need to roll that out to the population. Once we determine have you had infection with this coronavirus, now are you going to be protected from subsequent infections? And if you are, is it just going to give you mild disease? Or is it just going to protect you fully? We just don't know that. So that's a good question. As we move forward, hopefully we'll get the answers to those types of questions, but it will be some time.
Steve Stites, the eternal but very imperfect optimist, says that we're going to find out sooner only because of the ongoing trials of using pooled serum, even if we don't know if people have antibodies. We're just taking that from recovered patients and then giving it to others. And sometimes we think it's antibodies. Sometimes there may be other factors. And so if those trials look good, then we're going to say something about that recovery. It was interesting, though, to look at, I don't remember if it was a Korean or Chinese study that found 100 and some odd patients who relapsed and had another infection with it. Yeah. And I think what's notable about that is, A, you wish that didn't happen because it makes you a little concerned. But B, there have been I don't know how many hundreds of thousands now that have been affected worldwide, but we've only described a small number that got reinfected. Yeah. The reality is I think most people do have some form of immunity from it because they don't get reinfected.
And unfortunately, they also do state we can't tell if this is actual virus that you're shedding again, live virus that can infect other people, because these are just the nucleic acid tests that they're reevaluating.
Which means parts of a virus can be in your secretions, not be live virus, not be transmittable. And you may have a different type of reaction. You think about that. Sometimes you get a flu bug or whatever, and you feel sick for a while, and then you feel better, and then you start feeling sick again. You're like, why am I feeling sick again? Well, it's the same thing. Yeah. You can have the same recrudescence of viral illnesses. And I think coronavirus, in many ways, we have to remember, it's a coronavirus, and our response to it is going to act like the response to any virus. So I think our very long-winded answer to your question is that we just don't know. We have some hope, and a lot of the hope, in my mind, is founded on the fact that most people, once they're over this, are over it, and they don't get sick again. So there are a few that do, and that makes you. But we always know that that's true. That not everybody gets the right kind of immune response. So, other questions?
I have a question for Anthony. This is Taylor at 41 again. I guess it was early March. It was when this first really got started. I had a chance to interview someone that ended up getting COVID-19 in kind of in the first days of this, at least locally. And he described the experience to me. And one of the things that stuck out to me was he and his wife both kind of described just how different the hospital personnel were from day to day as they learned new things about this and learned different things they should be doing, different precautions that should be done, different treatment options. And he was in a situation where he left the hospital before his test results were back. His doctor told him, "I'm 99.9% certain you have COVID-19, but you can go home and quarantine," that kind of thing. I'm curious about what your read of how you were treated medically and how they were learning new things as you were there. Was it a different tactic every day, or by that point was it pretty normal day to day on what they knew about how to treat you?
Yeah, so for me, it was the virus still very new, and we were still getting information pretty much day by day on what the best practices were. The fundamentals pretty much stayed the same. Get your rest, make sure that you're cleaning hard surfaces that are around you, just kind of keep your distance from people. That kind of stayed consistent, those things that we've kind of been hearing. But I did hear like a few different things from day to day. One of the things was to drink hot fluids. This was like from the hospital. They told me like to make sure that I was staying hydrated, and I hadn't really heard that before. But they did tell me to just kind of stay hydrated, make sure that mucus isn't really building up in your system, that you're getting rid of it, those types of things. The treatment was different for myself and my family because I got tested and I got a positive test back. My mom got tested, she got a positive test back. And like the guy that you talked to, my sister, she wasn't tested, but they just said, hey, we're pretty sure that she has it. She's exhibiting all the symptoms, and she pretty much has everything, that says that she's probably positive, so treat her as she's positive. And so I would kind of communicate with my family, like, the things that the health system was mentioning to me. We even called, like, the CDC, some of the national hotline numbers to get information, just to kind of balance it with different people. So I would suggest that for people who are positive, to kind of get different sources, because everybody kind of has a different idea. And as long as it stays along the line of being safe and being healthy, I think that's all good advice to take. So I totally think that you should, as much as possible, get your information from different reliable sources so that you can have the best outcome for this disease.
Well said. My only comment to that is, fortunately, Anthony didn't have to be hospitalized, so he was an outpatient the whole time. But secondly, so what he said is about make sure you have reliable sources you're getting information from is really true. Other questions?
I wonder.
Hi. Sorry, you can go first.
No, please go ahead.
Well, go ahead. We'll let the media person go. That's fine. Tell me your name.
Well, I was wondering whether Anthony and his family had very different experiences in terms of the severity of the illness.
That's a great question.
Yeah, so thankfully, like, we all did. None of us were hospitalized. That's what I'm grateful for. I was personally concerned, and my siblings were concerned about our mom because she had heart failure, and we knew that was something that was one of those preconditions that people had mentioned. Hey, if you've had heart issues, that might be an issue to have COVID. But we found with her that we had to like tell her to sit down a lot, because she still was doing very well. Like she was getting up, she was folding the clothes in her room, she was washing the clothes in her room, and she would try to come out in the hallway and would say, you need to be in your room. So my mom was probably the one that we were most concerned about, just because of her condition, and she had like a surgery to deal with that, which was great prior to all of this. And so when we saw that she was doing good, that gave us a little bit of relief. My sister, who contracted the disease, she had a lot of fatigue. That was her thing. She was very tired, so she wasn't as upbeat as my mom was, which was very surprising. But she was very fatigued, and she really couldn't get out of bed much, but she was still doing pretty well. And as far as I go, like, I would have different days. Like, some days I would be very fatigued. Other days I'd be coughing up a lot of mucus and discharge. And then another day I would be on top of the world. So it really kind of varied for me, and I think for all of us, we had different symptoms that were prevailing.
That's a great description, Anthony. Thank you. I can't tell you how glad you're back. All right, other questions? I'm going to have to pop off a few minutes early today, guys, just so you know, as I have to hop on a phone conference. Before I go, though, I do want, and Dr. Hawkinson can, if there are more questions, can help moderate. I do want to let you know that tomorrow, Mark Steele, who's the Chief Medical Officer at Truman Medical Center, Raghu Adiga, who is the Chief Medical Officer at Liberty Hospital, and Larry Botts, Chief Medical Officer at Advent Health, will be joining our call. So we'll have multiple CMOs on the phone, which I think is great. We've had a really good working group. There may be a few other folks who are going to join us as well. We've had a really great working group where we've all been comparing notes and working together throughout the community. And I want you to hear that. So they'll all be on the phone call tomorrow. So other questions, either for Dr. Dendy or Anthony or Hawkeye or myself?
This is Nate from the health system. I just had something real quick. Somebody had asked yesterday if those with type A blood were at greater risk for the virus, and then I got a question this morning that said that there's some rumblings on social media that people are starting to believe that this is more of a blood disease than a lung disease. Can you speak to that?
Well, let me speak about the type A blood because I'm A negative. So I'm going to say, I sure hope not, no. Dana.
Yeah, this has been answered a while because this question has come up, and certainly a lot of social media about it. There's no compelling evidence. There's no evidence that this is actually any blood type. You're at more risk or you're protected from this. This affects every blood type. So, yeah, to put it bluntly, yeah, there's no evidence about blood type for that.
Which I'm glad there's no discrimination based on blood type,
right.
For anybody really, but for type A as well. As far as a blood disease versus a lung disease, I think, Dr. Hawkinson made a point a moment ago that it's tropism, Dr. Dendy, and one of the things about that is it can affect any organ. And so, but we know that it's spread most easily by respirable, those particles which we breathe out and in, which is what makes it so easy to transmit from one to another. But I know you've been treating some patients, and the disease can affect any organ, really.
Absolutely. And there's more and more data to suggest that these chemicals that are released as a reaction to the virus can go everywhere and cause a diffuse response. And that's why initially it was just lungs were in the news, but now you can see more and more patients that have kidneys affected, the heart affected, and clots. And so I think it's very important to know that this disease could diffusely affect the body, and we're finding more and more about it, and we're treating it more effectively, hopefully, as the time passes by.
Yeah, and we certainly know, and it has been documented in severe cases where they can find viremia, which means the virus is in the blood. But it's not the typical blood-borne infection like you think with hepatitis C, hepatitis B, HIV. So we know it can transiently be in the blood. You can certainly still give blood if you're healthy. If you are ill, you are probably not going to be able to give blood. And just a question for Dr. Dendy, and please tell me if I'm wrong, but I've also seen reports, and maybe we've seen that here, where people are having heart attack or having arrhythmias or problems, and they go to the cath lab, and they have empty coronary arteries, and everything looks good. I mean, normally coronary arteries, everything looks good. It's not like your typical heart attack, and we think that maybe the virus can be affecting it in that way. And I don't know if you see that in other causes.
Yes, so we typically depend on certain lab tests and EKG and other things to kind of get a telltale signs of having an acute heart attack, and sometimes it will save time to quickly go and open up an artery. But we've noticed that, like some other infections, COVID also causes false positive heart attack signs, like the cardiac enzymes can go up. The EKG can sometimes show ST elevations, which is one of the signs for heart attack. So we are very much aware of that, and we are treating those patients differently if they also have COVID symptoms. As a cardiovascular department, our labs are fully prepared for this dichotomy in situations where we are treating COVID patients with extra caution and care. We have a designated cath lab for them. We we want to keep non-COVID patients safe. Mm-hmm. So I just wanted to let people know that if you're having symptoms or signs of heart attack, call 911. And heart attacks don't stop during pandemic, and we have extra measures in place in the hospital to take care of you without you acquiring the infection.
Yeah, and I think it's important to emphasize that point. And before I have to pop off here and let you all finish, our emergency room has an area for patients that have COVID-19, an area for or may have it, be people who are under investigation, and an area for folks who don't. Because we try to separate right from the start, because we do know, again, it's respirable. That is, it can be transmitted through secretions. And as a result, we want to make sure that patients stay safe. Our hospital has, and I think most people have, they've cohorted patients together. So if you have COVID-19, you're in a different area of the hospital than if you don't. If you have to go to have a procedure, there's an area that does and an area that doesn't. And our whole goal with all of that is to make sure that we keep everybody safe, both the COVID-19 patients who are cohorted together so we have the right PPE in that floor, and those who don't, so they don't have to worry about being in contact. And so far, we've not had a case of a patient transmitting it to another patient. That's really important to know. And I think that's true for the medical community in general. People across the world have been really working hard at that. With that, I have to go, but Dr. Hawkinson and Dr. Dendy will still be here, and Anthony will still be here. I'm sorry, I have to sign out. Remember, tomorrow morning, it's a CMO party across the metropolitan area. We'll have some fun with that. So thank you all.
Thank you.
I'll be back tomorrow.
Okay. All right.
And Anthony, thanks for being on the phone.
Absolutely.
Okay, other questions?
If you're leaving, we can actually bring him in. It's social distancing we're practicing.
Oh, that's true. Where is he? Anthony. This is like
Headed that way.
Right, come on down.
All right. Anthony, come on down. Do we have any questions for Anthony or Dr. Dendy?
There was one question that came in. Somebody was wanting to know if we've seen any COVID-19 cases present with only gastrointestinal symptoms.
Yeah, I'm not aware of only with gastrointestinal symptoms. Certainly, maybe not in the hospital. That would possibly be reasonable if you had a very mild form of the disease, if you were an outpatient and maybe got tested. We know that can be one of the symptoms, and probably, depending what research studies you look at, anywhere from 2 to 5% to up to 30%. So diarrhea can occur. I don't know here at the health system. Again, probably if you're being admitted to the hospital, it's not going to just be some of the mild GI symptoms like diarrhea, but you're going to have more respiratory problems. All right.
This is Celia at the Kansas News Service again. I was wondering how many employees of the KU Health System have come down with COVID-19?
We have those numbers. I don't know the number off the top of my head. We do usually do deep dives and look to see the infections and where they got the infections. Certainly a majority of those have been through the community. Our numbers for employees having COVID infection is just about the same as the community, or even a little bit less. But I don't know the numbers off the top of my head. And we do have Anthony now joining us, as well as Dr. Dendy still. So.
Hi, this is Jackson Overstreet from Cape News down in Wichita. I had a question for Anthony. You had mentioned that you were tested for a different disease before you got COVID you were fighting. What was the difference between the two diseases that you could kind of tell that made COVID kind of different to fight?
Yeah, for sure. I'm used to getting the flu like at least once a year. I don't always get my flu shot. And I kind of know how it feels to have the flu. And that's what I had tested for a few weeks prior. And I had flu B. So they gave me the swab for flu B, to test for flu and to see what type of flu I had. And the difference, like I said, I had that irritation in my throat with COVID that I hadn't really experienced before. So that's one of the things that really kind of made me alert. With the flu, I was pretty much used to the fatigue from time to time and the stopped up nose or whatever it might be. Like, I was used to those flu symptoms and I know what those feel like. But when COVID came, I personally had some differences of feeling, and that dry cough was just really one of those alarming things for me personally.
Okay, and I know a lot of people have said, COVID is just a different version of the flu. You had both reasonably close to each other.
Yeah.
What would you say to that argument? What would you say to that sentiment that they're basically the same?
They're similar, but they are different. For me, there were just times that I would have. Like I said, I was never hospitalized, but there were times where I would just have some irritation in my chest, and I hadn't felt that before. It felt like it was a little bit difficult to breathe some days. Some days, like, I was just completely out of it. I was tired. I didn't want to get up. I didn't want to respond to text messages or phone calls. So I think there's a huge difference, especially when we're talking about the fatigue. There's some serious fatigue. And then the fear with COVID as well. That adds on to a lot of it because we don't know much about it. Even though I'm young, I was very, very scared. I was nervous about things. So I totally, I think COVID's a different type of beast.
All right, we have time for probably one more question. And I would also like to add on to one of the other answers that I gave, about our healthcare providers. Again, right now we have enough PPE. We're doing well. We don't want a surge to overwhelm our PPE and our healthcare providers. Of all of the healthcare providers that we've had on our COVID rule-outs and our COVID floors, including the ICU, I believe we've only had one provider that has been diagnosed with COVID. So that's a good number in itself, and the people that are dealing with it on a day-to-day basis. So we probably have time for one more question. All right. So with that, I would just like to kind of wrap it up here. I'd like to ask Anthony if he's got any more thoughts, and then Dr. Dendy as we leave today.
Absolutely. The only thing that I would say is just to listen to the experts. Keep your family safe as much as possible. My dad, I haven't mentioned much about him, but he was in our home taking care of everybody. And he didn't contract the disease from anything that we know. But we kept our distance. Everybody stayed in their own room as much as possible. The COVID folks, we have 2 restrooms. So the COVID folks would go to one restroom and shower and do everything there. And we just did as much as possible. We don't have a huge house, but just do as much as possible if you've tested positive to continue to social distance even within your homes. Yeah.
That's a great story.
And from cardiology point of view, I would say that heart attacks are still the #1 cause of death, even during the pandemic COVID crisis. And so don't neglect your symptoms. Call 911 if you have chest pain or other symptoms of heart attack or stroke. We have safety precautions in the hospital to take care of you safely without having further infections. And if you come late and neglect your symptoms, it's a lot harder to take care of heart attacks and you have more complications. And we are also available through telehealth. And so if you have any questions, whether this is urgent or not, we're seeing thousands of patients via telehealth, and we're able to answer all of your questions, and cardiac care has to continue. And we just have to take care of the community, and we'll get over this.
All right. And, as we wrap up, in the words of Dr. Stites, stay safe, stay at home, physical distance, wash your hands, don't touch your face, and most of all,
stay calm.
Sorry, stay calm. Most of all, show me that you can do it, Missouri.